How many of you would sit and listen to the sorrow, the hurt, the anguish, the pain, the palpitation that quickens as it goes insane? ¿Cuántos de nosotros escucháramos la pasión, the passionate plea to let us be, to let us see, and injustice become justice, and inequality become equality, a dishonor become honor, a death become life? How many of us would sit and listen to a cry of sorrow, to a cry of fight, to make things right? ¿Cuántos de nosotros escucháramos al corazón gritar un grito de angustia que asusta hasta sí mismo? Un grito de guerra que corre y palpita, que se llena de emoción, que transmite la pasión, que se sale para afuera. Un grito de guerra that leaps and leaps your own heart y te hace llorar, porque no puedes negar la injusticia, el deshonor, el desrespeto, el engaño a nuestra gente. If the heart spoke, how many of us would sit and listen to an angry heart? A la frente de nuestro vivir that calls for war, a chore most of us would rather put aside. The injustice, the inequality, the death that we must face. Si el corazón hablara, si el corazón hablara, if the heart spoke, would we really be telling the truth of the America that we live in? Buenos días. I'm proud to say that at La Fe, we run a social justice organization that is built around a holistic model. Ours is a federally qualified health center that has been around for 42 years. It is a center that was born out of single mothers in South El Paso. Mothers who wanted to create an organization that would not only provide health for their children, but provide a proper education, provide a decent shelter, provide a future of a good job. Most importantly, they wanted their children to take another road, to not continue on the road that our uncles, our fathers, our older brothers had taken. A road of alcohol, a road of drugs, a road of gangs, a road of violence, a road of prison, a road of death. Today at La Fe, we continue with that dream. We continue to want our communities to be able to have a better future. At La Fe, we attempt to provide the best quality health and human services possible to our communities. At La Fe, we believe that health is a right, not a privilege. We open our doors to as many people as we can with the accessibility and the staffing that we have. At La Fe, we believe in a concept called nuestro bienestar, the totality of health. That to do health is not just to treat people, but rather to deal with all the facets that touch the people that we serve. We need to deal with employment access, with spiritual health, with family strength, with social justice, with social justice, with social justice. Let's not blind ourselves that in America there is still a great racism, and we cannot blind ourselves to that. We must not blind ourselves to that. We must not be like the monkeys, right? See no evil, hear no evil, speak no evil. Porque chingado, there's a lot of racist people in this country right now that are speaking a lot of evil. It's not about healthcare reform. It's not about immigration reform. It's not about education reform. It's about this country finally having a person of color at the top leadership position. Isn't that beautiful? Isn't that just beautiful? See? We're not too loud-spoken, okay, or too outspoken. We also want to have technology access and computer literacy, education access, of course, healthcare, arts and culture, mental health, quality, affordable housing. La Fe's growing network, and I mean it's growing, right, because we're building another clinic. We're getting ready to break ground next early spring in 92 units of mixed income housing. The first mixed income housing that has been built in El Paso in 40 years. 4 blocks from the new federal courthouse, where we will mix lawyers, hopefully judges, with some children that have not seen many positives in their family. We have the largest HIV/AIDS center in El Paso, in West Texas, in southern New Mexico. We got caught with a scenario where the only other HIV/AIDS center was closed recently, and now we have to take 400 more patients with no money, with no resources. The La Fe Cultural and Technology Center is part of the La Fe Child and Adolescent Wellness Center complex. An attempt by La Fe to bring together your traditional healthcare, both medical, dental, health promotion, and disease prevention, and mix it with cultura and technology, and bring doctors and nurses and artists and poets and dancers together to see how we can translate and communicate a message to our people. You know, Dr. Smith touched on a subject that brought back some memories. And that was a subject that about 20 years ago, when I was one of 30 Hispano-Latinos appointed to a national panel to deal with HIV, AIDS, and substance abuse. And we were Puerto Ricanos, Cubanos, Colombianos, Hondureños, Mexicanos, and Chicanos, one Chicano. And we were constantly caught up in this thing that we need to do things differently for our communities, because we're different. And of course, the federal government would agree with us. And the federal government would say, you know, that's why we really can't help you guys, because you're so diverse. ¿Yeah? Y como ven tontos, iba a decir otra palabra. We would sit there and go, yeah, that's right. And yet, we were traveling around the whole country, including Puerto Rico and Mexico. ¿Sí? Desde Seattle, Washington, hasta New York. every city that we went to, guess what our people were doing? They were watching the soaps in Spanish. They were watching the commercials in Spanish. They were watching the beer ads and the tobacco ads in Spanish, and all of our people were understanding that. So we've got to get away from this thing that we have to do, different things for different types of our populations. If the tobacco companies can get us hooked on smoking, if the alcohol companies can get us hooked on alcohol, and in the low run, most probably in Mexico, you'll have ads on this type of joint and this type of joint, because it's legalized now, right? That reminds me that I need to go get my passport, porque what I'm trying to say is that we've gone through a lot of these activities, and we presented these activities to the government, and the government acts like if they don't know. See, that's why you should be so involved with this comprehensive health care reform bill, because we can put a lot of these things into that bill. Let's not get caught up in these myths that are out there. Let's get caught up in pushing our representatives, our congressmen, our senators, that we cannot afford to have a watered down comprehensive health care bill. If we get a watered down comprehensive health care bill, we are going to be worse off than we are today. Doesn't matter what the conservative Republicans say about there cannot be no public option. There has to be a public option. There must be a public option. That is the most important element in this health care reform bill. At La Fe, we administer the Children's Health Insurance Program. And the Children's Health Insurance Program around this country is facing some of the issues that Dr. Smith talked about. It's right there, and for some reason people just don't want to come. They don't want to come. You know why? One of the reasons is that they don't trust. They don't trust some of those government programs. So that looks kind of ironic, right? Because here you have some white, black, and brown, bigoted and racist people standing up there in the microphones and saying, like, government cannot run anything, right? Well, it's not that government cannot run anything, it's that there's too much bureaucracy within the government that needs to be put aside. That needs to be put aside so that when people start getting care, it's not taken away from them 2 years later, which is what happened to Chip in Texas a few years ago. We have a brand new La Fe Community Development Corporation, a corporation that is going to build a financial literacy center, that is going to build a community barrio credit union, that is going to declare war on the loan sharks, on the pawn shops, on the payday loans, because we'll carry out our credit union the same way that they do, except that we're not going to charge 25% interest. Most probably, they're not going to like it. Pero no le hace. We have a beautiful La Fe Preparatory School that we opened up 3 years ago. Pre-K, K, first, second, and third. Talk about it a little bit later. We have a senior companion program where we have seniors that go and visit homebound seniors and keep them company 4 hours a day. Play cards, play the guitar, knit, talk, check up on them. We have the La Fe Casa Star after-school program, which incorporates recruiting and targeting youth that have been getting in trouble and trying to bring them in and trying to push them to start school again. Treating them as human beings, not as gangsters, not as criminals, not as delinquents, as human beings. We have a new office. It's located in San Antonio, Texas. It's called the Fe Policy Education Research Center. It's located in San Antonio because San Antonio is close to Austin, and therefore we can do a lot of our educating, right? You can't use lobbying. Educating of our politicians. Poniéndoles un poquito así de tornillos, especially to the ones that are raza, ¿verdad? Next year, si el Tata Dios nos ayuda, we'll open up a Policy and Development Research Center in San Diego. The purpose for that is for us to initiate a new organization. An organization that will be built around California, Arizona, New Mexico, Texas, Colorado, Utah, and Nevada. An alliance that will primarily deal with the issues of the U.S.-Mexico border, where we will establish new legislation, new policies around our community here. As you can see, La Fe has a whole variety of different types of services and support. We have a health promotion program that includes an intensive diabetes prevention project. We've got an obesity prevention project. We've got a hypertension prevention project and a smoking cessation project through our pharmacy. Our primary medical care includes pediatric care services. I highlight pediatric care services because in America today you continue to hear politician after politician after politician after politician talk about us as immigrants as if we had just gotten here. As if we, like all of you that are brown faces here, all of us came together in droves. We're invading this country. So especially when we're on the U.S.-Mexico border, we tend to remind America that we really didn't cross the border. The border crossed us, right? See? So que no nos traten como que acabamos de llegar. I put down the babies because in the last census, the highest growing population in this country was us. We're young. And guess what? We're very, very fertile. The politicians tend to want us to think that the reason that we got such a big increase in the census was again because we had this influx of immigrantes. 50% of that growth was due to having babies. You know, pobrecitos, it's time, you talk about stress. You should send them your stress model. to the Capitol, so that they'd not be stressing out anymore on this brown invasion. This is not an invasion. This is our country. It's always been our country. And as much as they think that they can get us out of this country, they can't. We're here to stay. And they better wake up and smell the roses on that. The Child and Adolescent Wellness Center, like I told you, includes culture and technology. At La Fe, for those of you that don't know about it, we'd like you to come and visit the center anytime you'd like. You don't need to make any appointments or anything, just show up and the staff will take you around. We have 75 computer workstations. We have a Cisco Academy to train residents of the community to become technicians so that they can work on computers, so that their salaries change from a minimum wage of $7.25 an hour to almost $12 an hour. We have an audio, video, professional graphics design center. We're making posters, we're creating posters for our people. We are creating posters with the experiment that you see some beautiful posters. If you can't read the poster through a picture, that poster is absolutely worthless. It can be a beautiful picture, but if it doesn't have anything to do with the message, that poster is useless. Because we should be trying to do two things with that poster. We should be trying to capture the people that can read the poster, but also capture the people that cannot read. And people go like, pero Salvador, está bien bonito eso, ¿sí? The other thing with posters, and the other thing that we include with our audio, video, graphic design, is the verbiage that we use. You know, we got this poster from WIC, from the state, that said, si está amamantando su bebé, ¿quién sabe qué quiere decir eso? Huh? But that's not a word that we use. The common folk doesn't use amamantar. Where did you learn amamantar? Through your mother. Voy a ir a amamantar al niño. Eh? You know, we check out words in the Spanish-English dictionary, and we'll use the proper words. We need to use words that people can connect to. You know? I think so. Remember that famous commercial on Say No to Drugs? And it had a frying pan, and then it had some eggs. This is your brain. This is your brain on drugs. That's a great message for somebody that's doing drugs, right? You're going like, wow, whoa. We got to be real, because we spend thousands and thousands and thousands of dollars on those types of commercials. Our school. I invite you to come and visit our school. It's located on Father Ram and Florence Street, the old Roosevelt School. It's a dual language school. It's a thematic-based school. It's a school where all of our children are dressed up like preppy East Coast schools. The frozen Chicano activists criticize us because they're saying, oh man, now you're dressing up our kids like white kids. And I go, no, we're dressing them up like quality students. You know, these are the same frozen Chicanos that attack me, and I've become, I think, in the past 4 years, from being the most recognized leftist militant radical leader in El Paso to being the biggest sellout. Because I'm for us changing Segundo Barrio. I am for us either tearing down those tenements that are cockroach infested, rat infested, mice infested, lead paint infested, tearing them down or renovating them. Because these chiquitos, they don't deserve to live like that. They don't deserve to live like that. And these Chicano frozen activists, right? They live in Kern Place, they live in Sunset Heights, they live in Mission Hills. Some of their leaders are in this university. I tend to not name names, but I've asked for them to come and meet with me. They don't want to meet with me. They love to blog. They love to do anonymous ladders. Pero no quieren venir y pararse. Se me hace que una se llama, ¿cómo se llama? No, I shouldn't say it, huh? Se llama la doctora Yolanda Leiva. And she's one of the biggest critics, and she uses this campus, to tell lies to her students. And if any of you know her, you tell her I said that. My number is 915-534-7979. I do this because it is not right for the people of South El Paso. These niños deserve better. These niños are being taught in 2 languages. They've come to the university 10 times. 10 times. This year, most probably, we'll bring in 4 times. I don't know about you, but when I was in elementary school, we were never taken to the university. In this university, we have some of our greatest partners, starting with the boss lady, right? The boss lady is like a big-time supporter of La Fe. And most probably she's going to get a call from, what was her name? What was her name? ¿Cómo? Ay, le hace así quedito. From Doctora Leiva. And the president is going to call me and say, why did you do that? We've gone from a $3 million budget where we started 17 years ago, 60 employees, 1 clinic. Totally federally dependent. Totally federally dependent. With my tenure at NCLR, with National Council of La Raza, I have had the opportunity to travel around all over the country. Most not-for-profit organizations are totally dependent on the government. We have to change that. We must change that. Because when you're dependent on somebody that is not taking care of the needs of the people that you serve, you can't criticize them. You can't stand up and say things against them, because then you become like Acorn, the national organization that was just taking all their monies away. Today, we have 400 plus employees. We have 100 plus senior companions. We have a 23 million plus budget. Only 25% of that budget is government money. We've developed a hybrid model of social justice and corporate management, which is like trying to mix vinegar with oil, right? Vinegar with water, sorry. Estaba pensando en comida. Because on the one hand, Balcorta is talking about social justice and helping the people and helping the poor, and blah, blah, blah. And my financial people are out there telling people, you know what? There's no freebies. There are no freebies. See? You have to pay. Oh, but I don't have any money right now. Well, then you pay in payments. But I can't even pay in payments. So we're establishing a program called Banco del Barrio, where we ask a lady, what do you know what to do? I like to crochet. Can you help us with the kids? Can you teach them how to crochet? And for tantas horas que nos des, you can see the doc. Let's do it. I love to do this, I love to do that. Hopefully in January, we'll be able to get it going. There's different ways of us being able to bring our people into place. Bring our people into place. We have community outreach workers. We don't use the word promotora at our place. It's just something that we don't do. They go out and visit women, visit men. Your question on why don't we involve males? It's a great question. But that's the way the system's been built. That's the way organizations have been brainwashed. Males don't want to get involved. At our school, 90% of our fathers are involved. The parental attendance in our school is 85%. We go and talk to them. We go and visit them. Next month, we give rebirth to a program that we had that's called Hombres 2000, Males 2000, where we bring in males and we talk. It's almost like a redemption program. A redemption program where we tell youngsters that just got married or youngsters that have a baby that being a true man says that he's going to take care of his family. He's going to take care of his child. He's going to keep away from prison. He's going to keep away from drugs. He's going to change his life. That being a true man doesn't mean that you're going to have 3-4 women. A redemption program. Because we show them us. And we show them what we did that was wrong. Visit our clinic, our pediatric clinic, and you'll see these tattooed guys with their bebitos coming in to vaccinate them, coming to bring them to see the doctor. And I ask them, ¿Dónde está tu esposa? She's working. No, but no, también no, let's not go to an extreme, okay? See? We're going to have the same type of program for women. The same type of program for women. We feel very strongly that bringing in all these programs is what's going to start changing the face of our communities. Very strongly. You know, this is a great picture. It's a bunch of white runners, yeah? A lot of these guys are like the deep pocket guys in El Paso. The bankers and the lawyers and the guys that help us a lot. They come to our runs. They come to our different, by the way, for those of you that are from El Paso, tomorrow we have a Chicano Heritage Festival at the school, 3 to 7. Music, gorditas. I shouldn't be saying this in front of people from Paso del Norte. Gorditas, elotes, hot dogs. You know, just like once a year, Juanita, see? You know. You're invited. So, what happens with access to quality, affordable health care? We will have children that are healthy enough to meet the challenges of a good education. You know, in Texas, like in other states of this country, education has now changed into getting ready for a test. When you get to 3rd grade, this is the first year that we're going to be tested. And all of us are going like, oh man. And the teachers are going, do you think we need to change the mode and start like practicing? And I go, no. We keep it going the way we're doing it. We just ask the parents to help us. We're recruiting kids from the end school. Kids that aren't doing too good at the end, at the middle school, we're recruiting them to come and be tutors for these kids. And people go like, why? Why would you be bringing in students that are not doing very good in middle school to come in and tutor your 3rd graders? Because most probably they're going to be good at 3rd grade. And guess what's going to happen to their esteem? See? Believe it or not, that works. You know what doesn't work? The school districts that have failing schools, they're called failing schools, or do not meet standard schools. I don't know what they're called. You know what I'm talking about, right? That the students do not meet the level of the tax test, and so therefore they're labeled substandard or something like that. So then we have unethical school districts that are literally moving kids that they know that are not going to pass the test to another school. I think in about maybe a month, you're going to see this big investigation report that's going to put some of those people to shame. Last year, one of these high schools, the freshman enrollment was almost 400 students. You know what the enrollment was this year for sophomores? 180. That is not only unethical, that is criminal. You know, people say, well, you know, Latinos, Hispanos continue to drop out. It's not that they drop out. They're pushed out. You know, I was telling Dr. Smith that one of my most beautiful experiences in giving speeches around the country was going to Raleigh, North Carolina. speaking to about 1,000 people there in their photo. Most probably about 300 were students. 2% of the class, 10% of the class, many of them didn't know Spanish. Guess what? They weren't going to be able to go to university. Because they had been brought here as babies through no fault of their own. And so they're labeled illegal. And you cannot attend school. We've been trying to get a bill passed that's called the DREAM Act that allows those types of youngsters to be able to get their citizenship and go to school. At La Fe, we have a project called Youth Build, where we take youth that have been incarcerated and that want to go back to school. And we do a training with them in building trades, in nursing assistants, and this year we'll do one in culinary arts. We built this gigantic kitchen. It's an educational kitchen. We're going to bring in the people that are sick to learn how to cook. We're going to create videos to teach them what types of foods they can make. La Fe is just as guilty as most other healthcare organizations in this country, in that the information that we give people is what? In the written form. Even private docs do that, right? They give you, some of you I'm sure have hypertension or have cholesterol or have diabetes, and they'll give you these little booklets. Y no los lees, see? Most of us don't read that. It's not because you can't read, it's just you don't read it. It's like these papers that they give you, right, at the store for your warranties. Here's your warranty. Can you sign here? Or you want to read it? No, sign. Okay. And you say it and say it and say it. And you know, some of the biggest people that refuse to accept that? A lot of your academics. Because they go like, how dare he talk like if people were illiterate, if people had a low educational. I'm not saying that. I'm saying that for the most part we don't read what is given to us. Pretty sure there's some compulsive people here that are even going to read where it says printed in wherever. I used to do that with the material that National Council of La Raza had. And I went berserk because it said printed in China. And I go, So here we are promoting, see, that we have to print it in China because it's lower priced. We got to change a lot of those things. This young man is now in the university. We have about 24 of those young people in college and in the university. But guess what? Some of them are not going to be able to be what they want to be. The ones that want to be nurses, they can't be nurses because they already have a felony. The ones that want to be social workers, doctors, teachers, no child left behind has to change to no human being should be left behind. Let's give people a second chance. Let's give people a second chance. Let's give people a second chance. We need to. We need to. If Bibi allows us and gives us a copy of your of your list, of your addresses and stuff, we'll invite you to the next graduation of those kids. It's almost like what Dr. Smith talks about with her promotoras. You should see these kids, you know? I mean, with their suits and, you know, feeling really proud, and their parents feeling really proud. We had a young man that had landed in El Paso all the way from Washington, D.C. White, Anglo. And I go, what are you doing here? This is where I came so I wouldn't get in trouble anymore. And one day he comes to me and says, "Hey, Salvador, the migra stopped me." And he goes, "They didn't stop you." "Yes, they stopped me." And I go like, wow. "What did you tell him?" "Nothing." And I found out he was with another guy, a Mexican guy, see? So the Mexican guy started to run, and Lawrence started to run with him. That's the only reason he got stopped, but that was his badge of honor, right? I got stopped by the migra, you know? When he took his GED, ended up in the 99th percentile of this country's ranking. With access to quality, affordable health care, we can have healthy parents who can obtain and maintain jobs to provide for their family's future. You know, I was talking about the redemption program. We need to understand this as males, that in the Latino Hispano community, it's not the male that runs the family, as much as we would like to think that we run the family. Our women run the family. And yet, our women, like in most parts of the country, are the least to take care of themselves. Because things have changed, okay? Elder males usually didn't want to go to the doctor. Our generation, the young elders, and I need to use that word because, you know, if you're in your 50s, you can be a member of AARP. That's like so devastating, right? So now I tell these guys, all my staff, that they need to call me abuelito. Abuelito! See? They didn't want to go. Our elders didn't want to go to the doctor. We do. There's more of us going to the doctor than the women. Oh my God, and God forbid que nos dé algo serio. Oh, we become babies, you know, sorry. Me duele esto, me duele acá, que you're not taking care of me right. So it's important for us to have women that are healthy and strong. Our elders are our diamonds, our stars, our jewels. They're the storytellers. They're the history archives. They're the ones that can connect us to the back. We've been trying to do a Memorias project with the elders so that they can tell their stories. We've got males that were in prison for 30 years that are set up to do memorias so that one day, if they pass on, their children, who they don't know, because their children just, didn't want to have anything to do with them, so that their children can know who they are. We've got proud veterans of World War II, of Korea, of Vietnam, of the first Gulf War, that we want them to tell their story. It's very important for us to hold our elders in high esteem, and in the network of health. Y si te quieren dar hierbas, if they want to give you herbs, let them give you herbs. No va a hacer nada de daño. There's no doctors here, right? She left, right? But you're something else now, no? Studies show that if people are used to drinking hierbas, and if you give them a pill, and you tell her, si se toma con la hierbabuena, es 10 veces mejor. They take it nomás por seguir tomando la hierbabuena. It's true. I met this guy in New York that had a partner that was a santero. You know what a santero is, ¿verdad? Like a curandero. That's the way he would endulzar tu vida. Things like that. El rojo es para la sangre. Quiero que cuando vengas me traigas la botella. Y acuérdate que si no haces lo que te digo, te puede ir mal. Compliance like crazy. People say like, man, but that's like promoting something bad. I don't know if it's bad. All I know is those people, they believe in that. See? We need to, of course, increase local, state, and national funding for outreach and prevention. Health promotion and disease prevention is a big chunk in the legislation for healthcare reform. A big chunk. There's a National Health Service Corps in America that pays graduate physicians anywhere from, I think it's $75,000 to $100,000 to come and serve communities that are underserved. We need to establish a similar corps for the border, for the U.S.-Mexico border. There's a lot of legislators that are very, very interested in establishing that. And we could establish it not only for doctors and nurses and mid-levels, but for social workers, for educators. We need that. Of course, this is very big, and at La Fe, we've learned to do this, to collaborate with other non-for-profits, to collaborate with private businesses, to collaborate with educational, and to collaborate with government. Quite frankly, that's the way we've become big, by partnering with people instead of pushing people away. This is a little boy at Westway. He doesn't usually dress like that, okay? But he's with a Matachin group where we teach them, not only Matachin, but we teach them about issues of drug prevention, smoking prevention, staying in school, doing something that they like. We're starting a project with bringing the old games, like the tops, el trompo, the different games that we used to have. People said, the kids today, they don't like that. I'll tell you something. We, last year, one of our guys brought in an old LP record player. I didn't know what was going on, right? They were taking the little kids in there. When I got to the school in the afternoon, they were saying like, Salvador, we saw these gigantic CDs of before. And they go like, it was like really neat. We asked Hector if he can bring it again. See? We did a puppet show. You know, remember the old puppet shows? They were going like, they're not going to like it. They love it. It's something new for them. Again, some of the stuff that's been done throughout the country, use of novelas, visually oriented language, culture, literacy appropriate, educational materials for adults and children. We're going to be studying a school for the parents of our children. And we're going to be teaching them English, getting them ready to get their GED, and of course, getting them ready for their citizenship. But we're going to be teaching them the same areas and the same themes that we're teaching their kids. So in the afternoon, in the after-school program that we've got, we bring them together and they teach each other with a tutor that we have. You've heard these time and time again. El Paso's challenges. Widespread and increasing poverty rates. That's a national phenomenon with the Hispano-Latino community. Percentage-wise, we're the highest in the working groups. So we work. You know, we're not here just living on welfare. We work. The problem is that we don't get paid. High cost of health insurance for small businesses. See, the small businesses that have insurance for their employees can only afford it if they get like a $10,000 deductible insurance. That's not right. Those small businesses should be able to provide health insurance for their employees at a low rate, at a rate that is equal to the pay that they get. Of course, our dropout rates and the lack of support. I talked about the healthcare professional shortage. I talked about the low and unfair medical reimbursement rates. I talked about the lack of adequate local, state, and federal funding. On the healthcare reform, like I said, investing in prevention and wellness is one of the big issues. It is a great injustice that poor communities like those along the U.S.-Mexico border do not have the same Medicaid, Medicare, and physician pay rates as wealthier communities. That is wrong. In Texas, it is blatantly abused. Houston, Dallas, Austin, the reimbursement rates are almost double and triple the rates that our physicians get here. Ladies and gentlemen, 50 million Americans live without insurance. Thousands and thousands of people are dying because they don't have insurance. You have people that are opposed to the healthcare reform, and they stand up with a Bible, and they say, I do not want healthcare reform to pass because it includes abortion, and I believe in life. even after they've been told it does not include abortion. I believe in life. What I answer to them is, if you believe in life, what about the 50 million lives that have been sentenced to death because they get no care? Se muere otro niño, se muere olvidado, por falta del dinero, la vida se le ha acabado. A child dies, forgotten, without money, without insurance. Endurance didn't cut it. Another child dies, he didn't stand a chance. And in this day and age, it really makes no sense. Ahí va otro niño, ya lo van a enterrar, y la pobre de su madre no puede ni llorar. Another child dies, and I can hear the cries, the pain, los llantos de los padres, the screams of hurt, the screams of hurt, los gritos de dolor, los llantos de familia, al perder un dulce amor. Another child dies, and I can hear the cries, a community reacting and questioning the lies. A child that was refused, the simplest of the simple, and one can't even cry as we bid a sad goodbye. Another child dies, and I can hear the cries, a community reacting and questioning the lies. Se muere otro niño, se muere olvidado. La comunidad responde, ya no se esconde, pide respeto, pide simple dignidad, pide sus derechos, a la famosa igualdad. A child dies, having been refused, abused by a system's neglect for life. Se muere otro niño, la pobreza lo ha matado, no tenía aseguranza, de su vida fue robado, ahora ya enterrado, preguntamos que por qué. A child dies, forgotten, without money, without insurance. Endurance didn't cut it. We talked about the reforming of the physician payment system. We talked about reforming the current system into providing high-quality care rather than simply from procedures and exams. We talked about the myths. Do not believe the myths of socialized medicine, of death panels, of a tax on small businesses, of medical coverage for the undocumented, of provision for abortions. To quote the president, I am asking you to believe, not just in my ability to bring about real change in Washington, I'm asking you to believe in yours. Ladies and gentlemen, we have a man who has only been in office 9 months. We must come to his support. We must rally around him. We must not allow him to allow these people to dilute the comprehensive health care reform. At La Fe, we totally endorse comprehensive health care reform for our nation's families. La Fe will never settle for less or support a watered-down version of health reform that does not protect or address the needs of our communities, families, their well-beings, or their future. At La Fe, we believe. We hope that you believe. De parte de nosotros en La Fe, un fuerte abrazo, tierno beso, que el Tata Dios los bendiga. Thank you.